is already positive, then still your pap smear can be normal. So you will be earlier with some more investigation, or already in deeper cell layers there are already changes, and you know exactly if you must be a little bit worried, because only the higher risk HPV ones can cause problems. So you control it more intensively if HPV high risk is positive. So you will be definitely in time. With the pap smear you can miss it, because you can take away some cells, and it's always the question, is that already visible that there is HPV inflammation? So the technique of taking it away the cells is the same, but the result of the HPV culture is more reliable.
So right now, which technique are you using?
Well, at the moment we're still using pap smear, because it's less expensive.
Wow.
Yeah, that's always a question of money. It's expensive, and at the
But
moment
it has to do with life.
yes, no, but it's always cost benefit. Yeah? Because normally spoken in Holland, 200 women die, become dead, or die because of cervical cancer. And if you do all the people of investigate HPV, it will be maybe more costly than just treat the cervical cancers. So it's the cost benefit for the government and insurance company. But now the figures will be more clear that HPV culture gives a better result. The situation will turn around.
But do people have the choice to make? I mean, if they have the money, can they choose what they want?
That's possible.
The best treatment.
The best prevention. HPV culture will be in the near future the first choice of control. And if at this moment women will have it can be done, but then it has to be paid for. Yes.
So if HPV goes away, can a person get it again?
Yeah. Because if the immune system gets rid of it, and you have a new partner with HPV, you can get it again. So that's the reason why if you have a vaccination, your antibodies will be much higher and stays for maybe for your whole life. If you get rid of the normal inflammation of HPV, then it will be completely clear again. The antibodies will also in a low level. You can get it again. That is the reason why for the vaccine they put an extra stuff in it that gives a better reaction of your body. So your antibodies against the HPV will be much higher and stays much longer in the body than when you have an inflammation the natural way.
You made mention of something screening. You said that is a better option.
Well, we screen at the moment with the pap smear, but if we screen with HPV culture, it will be more reliable.
Yeah, that's the thing. That has to be the best. And one that is more reliable, so that people's life mustn't be tolerable.
That's right. But it will come. It takes some time, and the Gezondheidsraad has given the advice already to the government, and they are looking at it, and I think it will come in the near future. Because they must find always money for the screening.
Yeah.
It's more expensive.
Wow.
Who is spending the money? The government.
The government, yeah.
So all of these bills we are paying with sick and funds and all, doesn't cover that.
One more time?
I mean, the health insurance bills we are paying doesn't cover that.
No, it doesn't cover it. No. Yeah, it is rather difficult to understand if you say it's life and it's worth living, and why don't we give everything for it? But the health insurance has a special amount of money, and then they must do everything for it. So they must make choices, and it will change. They will also take this in the normal screening, the HPV.
Does having HPV affect one's chances of getting pregnant? or having healthy babies? Tell me this
Sure.
truthfully because you are a fertility doctor.
Yeah, it's a good question, but there's no influence on the, there's no risk for a pregnancy, there's no risk for a baby.
Oh.
So that's not the reason why you have, must do the screening. Screening is especially for the development of cervical cancer. But on the other hand, if you develop cervical cancer and you get an operation, it's a very big operation, then your uterus will be taken away and a lot of implants, and then you can't get babies anymore. So far away, it's also influencing your chance on pregnancy.
Yeah.
The direct influence is very low. If you have HPV, you still can become pregnant without it.
Wow. So, how can people get more information regarding this item? And what advice do you have for our listeners?
My advice would be that you, for two things especially. Go regularly for your pap smear control. You know that for women it's every 5 years that you get a pap smear, and in the near future it will change to the HPV culture, and then you always will be in time, even if you have HPV, even if your immune system is not strong enough, the changes of the cells will be defined, and then you can get treatment of the precancerous changes with a small slice of your cervix, and that has no influence on becoming pregnant or your pregnancy. Is one. And the second one is, if you get the chance for your daughters to get the vaccination, do it.
So at what age must they begin to get this vaccination?
12 years before they are sexually active. It's the most chance that is completely taking the chance of 16, 18 away.
Yeah.
There's also one other thing. Why don't we vaccinate men?
Yeah, that's what I want to ask you.
The point is that for a man, if he has HPV, the chance of penis cancer is very low.
Oh.
So the cost benefit for vaccination of men is mostly for the cost and not for the benefit. So that's the reason why men at the moment is not for a vaccination program, because then it's so expensive for very little preventing of penis cancer, because there's not much penis cancer.
Oh, there's nothing like that.
No, for women it's much more.
Yeah.
Much more.
Yeah.
So the reason is, and if you have all the women vaccinated, then even if the man has HPV, she's prevented again 16 and 18.
Yeah.
So the effect of cost benefit for the women is much, much better.
Yes.
But if you want to protect your sons,
yeah,
it's still useful to do the vaccination, but the chance on penis cancer is very low. So
there's nothing like penis cancer, it has not yet come.
Well, it comes once in a while, but it's still once in a while and not so often as the cervical cancer, much more. Yeah.
That would be too dangerous.
Yeah. Yeah. So it's different. Yeah.
So, Dr. Oey, do you think there is more increase in cervical cancer than the past years? Is it of more increase? Is it increasing more?
No.
Or is it reducing because of some of these medical treatments?
Yes, it's reducing. Because
what's the ratio?
Pardon?
Do you have any ratio?
Yes. When I started in the 70s with my becoming psychologist, the chance on cervical cancer was that it was about 250 and 300 women dying a year of cervical cancer. At this moment it's 200, and it's going down at the moment because the system of pap smear control and now the much more knowledge of the HPV, you already can in a very low space take the small slice of cervix and they are healed of it. So it's going down, yeah.
So for women in the third world countries, do they also have this pap smear control, or
That would be a good idea, but
they don't have it?
they don't have it yet. No.
Oh God.
So yeah, that's really yeah. But it's with everything in the health things, the possibility, everything costs a lot.
Yes.
There must be, even if there must be fridges, there must be transport.
Yeah.
It's very difficult in the developing countries, but they are doing it fast to make it better. But still, everything is money, money, money.
Yeah. So specialist doctors like you don't like to go over there.
Oh sure, yeah.
I mean, once in a
But
while to just go and do
well,
something.
yeah, there are
control.
several companies here who send doctors over there. That's not the problem. The problem is that still the fridges and the transport, electricity, and all those things is still on a low level.
Yes,
that makes it
exactly.
difficult.
I do understand. Yeah. So what is your advice for our listeners? According to what we discussed.
I've just said, do your routine controls every 5 years now, and vaccinate your daughters. That's the most important to do. Huh?
Yes.
And from the one of the vaccines, which also has 6 and 11, prevents against genital rats. They're not dangerous in case of cancer, but it's a nuisance to have rats. They can be very big, and then you have to have an operation, and it's not nice to make love if you have rats, because you always...
If you have rats?
Rats, yeah.
Really? Rats?
Yeah, we say ratten, hè?
Yeah.
Condylomata.
So you have rats?
Rats,
so
yeah. Because, well, it's not nice to see.
Rats in your private part?
In private parts, yeah.
Is it for men or for women?
And both. Women have it mostly on their lips, protecting lips,
Yeah.
and a little outside of it, around the anus,
Yeah.
and then a big tumors, white. It's not nice.
I know, even up there, you can see my facial expression. Oh, you doctors see a lot.
And then you have it on their penis, of course. Yeah.
Would you like listeners to, would you like to give us your information in case any person is out there and maybe they won't want to contact you?
Yeah, sure.
Is it possible?
Possible.
Okay, can you do that before we sign off?
I can't remember very well the
Will you
mail
call
address.
Voice of Naija, then I can give them your
Yeah, I'll give you
number?
my email address.
Email address.
Yes, for the practice.
Yeah.
And then always you can ask. Yeah, sure.
Okay, so in case you're out there and you are feeling shy, you don't want to call in, Dr. Oey still wants to take some of your questions, and then you can call us on 06846065550, and then I can give you their practice number because I don't have it offhand right now, but I do have it. Then you can contact Dr. Oey by yourself. So thank you so much, Dr. Oey. We think we have really enjoyed this program with you.
Yeah. One more time.
Yeah.
One more time. Do the vaccination for your daughters. Protect them. Huh?
Yeah.
Yeah.
And also your sons too.
It's not, yeah, if you can afford yourself. Yeah.
Thank you, Dr. Oey. Thanks.
Okay, welcome.